Okay. Hi, everybody, and welcome to the webinar for the Best Starts for Kids Evaluation RFP. My name is Eva Wong. I'm one of the leads on the evaluation project. And next slide. What we're going to be talking today, we have about 45 minutes on the phone, and what we'd like to do is just give a high-level overview and save as much time as possible as we can for questions. So on the next slide, what we're going to cover today is very quickly, what is Best Starts for Kids? Then in the second section, an overview of the in-depth evaluation RFP. If you haven't already, please look at the application that's available through Zoom Grants. And then we'll save most of our time today for questions and answers. The audience is muted right now, so please use the chat box. You might see that on your computer, or over the phone. We'll open up the phone line for questions later on in our webinar. Next slide. So very quickly, what is Best Starts for Kids? There is a vision that we want to have all babies born healthy, more children thrive, and more young people grow up to be happy, healthy, and successful adults. So this Best Starts for Kids is a levy that was approved by the voters of King County in November of 2015. It is a 6-year levy that will go through the end of 2021. There are several components to that. The first is promotion, supporting the good, prevention, early intervention for kids who may have gotten off course a little bit, and then policy and systems change work. Next slide. So there are 3 main investment areas for this work on the programmatic activities. The first is investing early, which is mainly funding services in the prenatal through 5 age group. And that can range from anything from child care health consultation to evidence-based and evidence-informed home visiting programs, child care health consultation, universal developmental screening, and an innovation bucket. So there's a set of activities which are will be RFP'd later this year. The second mainly focuses on children who are between the ages of 5 through young adults, age 24, in recognition of the brain science. The first part, prenatal 5, is approximately 50% of the levy proceeds. Sustaining the gain for ages 5 through 24 is approximately 35% of the levy proceeds. And that includes a number of different areas around school-based partnerships, healthy and safe environments, youth development, and stopping the school-to-prison pipeline. This RFP will be seeking applications that will be focused on the first 2 areas. Not all investment areas will be evaluated under this RFP. The third area is communities of opportunity, and that had a separate evaluation RFP that was put out last year and awarded and is underway. There's also a separate bucket of activities around youth, family, and homelessness prevention that also has been evaluated separately and is not part of this set of activities. Next slide. We're having some technical difficulties, so there is a next slide, and I will just continue talking. So there are those 3 main programmatic areas, and of the levy, 4.6% is allocated for evaluation activities. Thank you. And so that 4.6% really goes to many different activities, some of the work that will be funded under this RFP, as well as some other activities. And there are internal staff assigned to this project. So this is a cross-departmental project between Public Health, Seattle and King County, and the Department of Community and Human Services. And we have internal staff working on this. And they are the ones who've developed this very high-level evaluation plan. You can find both the evaluation plan and the implementation plan that has been approved by the County Council online. There is an investment of $2 million for external evaluation as part of this work, and that's a biennial investment. So next I'm going to turn it over to my partner, who will talk in depth about the evaluation RFP. Thank you, Eva. Hello.
I'm June Lee, and I'm the co-lead of the BSK data evaluation team in the Department of Community and Human Services. I'm going to provide a high-level brief overview of the in-depth evaluation today. So as Eva mentioned earlier, that we are seeking application for RFP, in-depth evaluation RFP in two large investment area, which is prenatal to 5 and 5 to 24. So for prenatal to 5, we are seeking application in 3 strategy areas: child care health consultation service delivery, and community designed home-based programs and practices, and technical assistance. And for the 5 to 24 strategy areas, school-based partnership and rebuild the village. So this slide shows kind of provides some additional information about webinars, if there was one recorded. So in these areas, there are recorded webinars related to these different strategy. And currently, not all the strategy areas have the grantees or RFP out yet. So this is just what's available as of now. So for this RFP specifically, we expect to fund at a range of levels up to $400,000 per for 2018 and 2019 for up to 3 years. And funding amount in the RFP is for 2018 and 2019. And funding beyond 2019 will depend on King County budget approval process. And we'll try to align the evaluation contract period with the program contract period as much as possible. And there was a question earlier whether that this RFP application should address only 2018 and 2019 or should factor in beyond 2019. And we suggest that if factor in what's going to happen and look at the time beyond 2018 and 2019 and just propose the overall evaluation plan for the specific project or strategy you're applying to. So for this RFP application, we are seeking information in these in a few areas. General questions. This is about organizational capacity and experience, and also proposed activities and method. And there are also components we're asking about the project specific questions. And then there's a budget. And then 2 things that I want to note is that we are we're paying attention to whether this application is looking into collaborative approach and authentic engagement of stakeholders and community partners throughout the evaluation planning process. And the other key component is whether this application is using the equity and social justice lens throughout the application, throughout the evaluation process. Let me see. So there was a question about where they can find more information about the project-specific description or areas of interest. And you can find that information under evaluation scope and also deliverables and expectations on description tab on Zoom Grant. So those information, all the high-level description of the project per each strategy area is listed and provided on description tab on Zoom Grant. So I'm going to go over briefly the timeline of this RFP. So RFP was released on April 9th, and today we are having this webinar, and we're getting questions from the interested applicants, and final day to ask questions by us is May 7th, 5 p.m. because we would like to have some time to respond to your questions, and then you also, all the applicants have time to actually incorporate our response back to their application. So the final day to ask questions is May 7th, and RFP response is due on May 14th, 5 p.m. Pacific Standard Time through Zoom Grant. And after we receive the application, we'll conduct interviews if necessary in late May, and we will notify all the selected applicants on June 4th. and early start date for those, any of the contract will be August 1st in 2018. And this is our tentative timeline as of now, and it could be subject to change after the RFP is due back to us. So as I mentioned earlier, all the application needs to be submitted and received by May 14th at 5 p.m. via Zoom Grant. And in using Zoom Grant, you will see the project narrative and project-specific questions will have character limits. And also all the required documents, such as, I think, resumes and then examples of some of the work, infographic materials and things like that can be, or any other optional documents, such as letters of reference, can be uploaded on the appendix tab. And then also there was a budget template has been provided. This is a basic template for you to use in case it's helpful, but I think additional lines can be added if needed for you to add any other items or line items that or categories that is not currently on the budget template. So the rating criteria for the RFP application will be in 4 different large categories. So the first one is the organizational capacity and experience. It's a total of 45 points. It includes organizational structure, staffing and resumes, and evaluation examples using equity and social justice lens, and evaluation experience in King County, an example of a dissemination materials. And the second component is the proposed activities and method, which will have a total of 45 points as well, include the project work plan and community and partner engagement and evaluation and project timeline and milestones. And then the third component, there will be some project-specific questions depending on which project you're applying. It ranges from about 15 points to 25 points. And lastly, there will be a budget that will be 10 points. So other than the project-specific question, there will be a total of 100 points. And then for the project-specific question, there will be additional 15 to 25 points on top of it. Next slide. So throughout this RFP, before the RFP is due, that question can be submitted to bsk.data@kingcounty.gov or via activity log on Zoom Grants. And we will try to respond in a timely manner, I think usually, and then answers to the questions will be posted in question and answer documents. Under library tab, if you go to the Zoom Grant, you'll find the library tab, and we'll post a document that shows all the most recent updates to the top, and the least, the old questions and answers to the bottom. So the questions will be posted every week. Questions and answers will be posted every week. And then updates to the existing RFP information or materials, if there's any update. For example, I think there was a question earlier about whether the implementation plan, linked to the implementation plan and evaluation plan was not working. So I updated those materials. So, and then those kind of updates or changes to the actual RFP information and documents will be posted in update document in the same place where the Q&A will be posted, which is under library section. You will see the library tab on one of the your application tab, and then it will be posted every week as well. So that's a sort of high level overview of the current RFP, and then we're gonna have time to get questions and answers. And before we do that, do you wanna just respond to what we received so far? Answer those what we received so far first.
Sure, we have I'm popping back into the screen. We have several questions that we received over the last week, and we just want to respond to them. So the The first question was about experience working in King County and whether it's sufficient to describe experience conducting evaluations of programs and activities to support children, youth, families, and communities in other locations. Yes, please describe how you've done some of this work in other areas, and also discuss how you might partner with King County organizations and any existing relationships you might have that will help support your work here. There is also a question about the number of people served from each programmatic area outlined in this RFP. For child care health, sorry, we will, we'll get back to child care health, but around community design home visiting, we expect 250 to 400 families will be served annually. Help Me Grow, the Within Reach and Crisis Clinic have planning grants that have been awarded. School partnerships, we're not able to provide the number of people served yet at this time because the organizations are still being identified, but we expect to have the, you can look at the number of programs and organizations that are expected to be partners in the RFP itself. Rebuild the Village served about 40 youth in the last quarter of 2017. And then with child care health consultation, do you want to come up? Sure. We have a full team in our room here.
Yeah. So I'm Jessica. I manage the child care health consultation work. And for this body of work, we've just made awards. We have 7 agencies that'll be serving child care providers as well as informal caregivers. And so there's a really broad range of estimates right now on how many kids and child care providers will be served. Typically what we're seeing is between 10 and 50 child care providers. And then the children that they serve can really range from 1 child if they're an informal caregiver to 50 to 100 if they're a licensed center. And so we're working on getting a stronger estimate of what those numbers will look like for number of children.
Thank you, Jessica. Thank you. And then there was a question about, is there a limit to the number of evaluation strategies for which an individual organization can be considered? There is no limit. It would just be what your organization can complete. There is a question about midpoint evaluation report and final evaluation report and when that would be due. So I can't give one answer because some of the timelines are different. Rebuild the Village will have a separate timeline. For the other strategies, we expect a midpoint evaluation report somewhere around August of 2020, with the final report due sometime in the first quarter of 2022. Rebuild the Village, because it has a shorter timeline at this time, we expect to have a progress report and a final report due for that area. There was also a question about in what ways are awardees across the 5 programs and strategies expected to collaborate with each other? Are each of these viewed as distinct projects, or does BSK envision joint efforts between awardees and or across program areas? So each of the projects are considered distinct areas. However, there are some areas where there does make sense to have some alignment and ensure that there is at least some discussion and communication and clear paths of communication across those areas, particularly among the child care, health consultation, community design, home visiting, and the Help Me Grow work. There's a lot of alignment in those programmatic efforts, and so therefore it makes a lot of sense to have some alignment in their evaluation activities, although they all are considered distinct projects.
Okay. And then I think Eva kind of addressed it earlier, but there was a question about whether BSK currently contract with an external evaluator who have designed the overall evaluation plan. We don't currently have any external evaluator, and then the evaluation plan was actually developed by our internal BSK evaluation team in collaboration with the program staff and our external community stakeholders, such as evaluation advisory group specific for the BSK, and also Children, Youth, and Advisory Board.
So there are 2 finance questions. So there are 2 financial related questions, and I'm going to read off the questions as well as the answers that we've received from our finance team who are not here in the room. So if you have additional questions, please include them in the chat box or through Zoom grants, and we will work to get you an answer to that. The first is around direct costs and what is allowable. If an agency has a federally negotiated indirect rate, you can charge up to that rate, and you have to provide a copy of your indirect determination from their cognizant agency. If you don't have that, we allow up to a 10% indirect rate. The second question is about, can we use fully loaded hourly rates for staff time? And we would rather see the staff time broken down for salaries and benefits and any related direct or indirect administrative charges separately. If you want it to be fully loaded, then whatever indirect rate they have will be included. So I think that's all of the questions we've received beforehand. Oh, sorry.
There's one last question about data solutions. So the question was, what is the current status of the data systems developed by Best Stars for Kids that would inform the evaluation? So currently there is a data solution, there is a effort underway to identify or create a data solution for some BSK strategy. But currently we have many different data systems for different programs, for existing programs now. So I think to answer these questions, I would assume that the basic data around demographic and performance measures will be available at a basic level for all programs. And then the further detail would be identified. But as of now, this data solution will be hasn't been RFP'd out yet to identify a vendor. So it will be a long-term project and process. So I think that's everything that we received so far. So we're going to open up for questions. So we're going to do unmute.
So we are unmuting the audience as we speak. Okay, so the audience is now unmuted, but please, you may also be on mute on your end, so please make sure to unmute yourselves as well. So we will take questions through the chat box or over the phone. So the question is, would it be a conflict of interest for an organization to submit a proposal if a member of that organization sits on the BSK Evaluation Advisory Group? So it will not be a conflict of interest if that member has no part in your application and has no part in the review of your application. I would encourage you not to work with that Evaluation Advisory Group member unless it is a question about, hey, where can I find these publicly posted materials? But if you do have questions, I encourage you to send them to us via bsk.data or through Zoom grants.
So the next question is the funding for each project $400,000 per year or $400,000 for 18 months? So the answer is that yes, it will, assuming that the contract will start in August, it is for the 2018 and 2019. The $400,000 is for 2 years, the remaining 2018 and the rest of the entire calendar year of 2019.
I think the audio lines should be open if you have questions and want to ask that way as well.
Hello.
Hello.
Hi. Your voice comes and goes, so I'm not sure if one of our questions submitted was answered. We were wondering if those help me to grow in their technical support, all of those organizations were already identified or not.
Hi, thank you. So the question is around Help Me Grow awardees, as well as the Parent Caregiver Education Support and Family Engagement awardees. Those program grantees have not yet been identified because the Parent Caregiver Education and Support and Family Engagement RFPs have not yet been released. Help Me Grow is in a planning stage and has 2 planning grants that have been awarded, and they are to Within Reach and the Crisis Clinic.
Okay, thank you.
Again, all those questions that we're getting today and our response will be posted on the Zoom Grant website. So if you haven't had a chance, if there was an audio issue, that you will be able to see our response to your questions. Any other questions? We also have a program staff here in case you have specific questions about specific programs. So if you want to understand more about any of the programs, now is a great opportunity to do so.
Okay, so we're not seeing much on the chat box. So we will just wrap up today's webinar. If you have additional questions, please feel free to use the bsk.data@kingcounty.gov email address, or through Zoom Grants, there is an option to submit questions through that platform. And we look forward to hearing from all of you.